I'm Professor Graham Roberts. I'm a paediatric consultant working at the University of Southampton. My role on the U-BIOPRED project spans quite a lot of the project. I'm leading the paediatric cohort. I'm also working with the analysts to make sure that we get the best possible analysis of the data so that we can understand what's going on in these group of patients with severe asthma. So the U-BIOPRED project really is starting right at the bottom, trying to understand what the difference is in the level at the cell between patients who have bad asthma and patients who have mild asthma. If we can understand those differences, we can then work out why some patients have asthma that just doesn't come under control. And that gives us some ideas as to how we can actually treat those patients better in the future. So at the moment in the U-BIOPRED project, I'm focusing on the clinical data and making sure that's pristine, so when the analysts come to utilise that in their analyses, we get the best possible outcome in terms of the results from the study. So the big achievement from my perspective for U-BIOPRED is actually successfully collecting a huge cohort, over 1,000 patients with asthma, both adults and children. And this is the biggest cohort that has been collected. More specifically, this cohort is very, very well worked up. So we know a lot about the patients, which should really help us to understand what's going on with severe asthma. So the last phase of the U-BIOPRED project is really the interesting bit, because that's where we get to find out actually what is different between patients who have asthma that's controlled and patients whose asthma is just simply not controllable. And that will give us some really useful insights into what the differences are, and therefore we can target those differences. The findings of U-BIOPRED have a potential to really change the world of severe asthma. If we can actually find what the differences are between patients who have severe asthma and those who've got mild and moderate disease, we really have a great opportunity to really generate new approaches to target the severe asthma group and really to help them to control their asthma. If U-BIOPRED manages to find those differences, and if they are ones that we can target with new interventions, new treatment, that could be a step change in terms of managing severe asthma. And what is currently severe asthma, in 10 years' time, those patients may have asthma that's actually controllable, and their quality of life will improve and they get on living their lives like the rest of us. If we can find big differences in U-BIOPRED between patients who've got severe and mild or moderate asthma, if we can utilise those differences to develop new interventions to target severe asthma, there's a real potential that patients who today have got severe asthma could, in 10 years' time, have asthma that's under control. That's really important for those patients. Their quality of life will improve. They can do things that they couldn't otherwise do. So U-BIOPRED is opening a door which hopefully our patients can walk through to a brighter future.